We must also remember his increasing emphasis on economic issues all across the country. By 1968, Dr. King was planning a campaign to call attention to the plight of poor people throughout the nation. That spring, he traveled to Memphis several times to support a strike of sanitation workers who were denied decent wages and fundamental human dignity. And by the night before he was assassinated, when he said that he had seen the mountaintop, Dr. King had envisioned a new movement for economic justice that would unite all Americans from every area and every background. Now, as we look back on Dr. King's service, sacrifice, and struggle, we can see that one of the defining goals of his life's work was access. He led a movement that fought for equal access for all Americans to public accommodations, equal access to the public schools, and equal access to polling places. And in the final years of his life, he also fought for equal access to economic opportunities for all Americans, regardless of color and regardless of class. In Dr. King's time, economic justice required equal access to good jobs. And in those days, it was almost taken for granted that good jobs came with health benefits. Nowadays, we need to make clear that we are not only fighting for access to opportunities for education, employment, and empowerment. We are also fighting for access to health care. Make no mistake, accessible, affordable, and secure health care is one of the most important civil rights issues in today's America. Make no mistake. Health care is inextricably linked to every other aspect of economic justice. When a medical emergency can bankrupt a family, there can be no economic security without access to quality and affordable health care. When chronic medical problems can prevent a worker from finding, keeping, and advancing at work, there can be no employment opportunity without access to quality and affordable health care. When poor health can keep a child out of school, there can be no educational opportunity without access to quality and affordable health care. The fact is, inequality begins before birth and lasts a lifetime. As recently as 2004, Hispanic and African American women were more than twice as likely as white women to receive only very late prenatal care or none at all. Native American women were more than 3 times as likely to receive late prenatal care or no care at all. Given the racial disparities in prenatal care, it is not surprising that there are similar racial disparities in low birth weight babies. In fact, African American women are twice as likely to give birth to low-weight babies as white women. In our nation's cities, these disparities are even worse than the national average. Right here in the nation's capital, access to early prenatal care improves for white women, but gets worse for Black and Hispanic women. Minority women are over 3.5 times more likely to go without first trimester prenatal care than white women. The incidence of low-weight births among Black women in the District of Columbia is almost triple the rate for white women. Now, what produces these racial disparities? All the usual suspects have a hand in the problem. Differences in income, education, nutrition, and language barriers all play a part, and almost all must be addressed. But 2 critically important factors are whether these women have health insurance and whether they have access to competent caregivers. These racial disparities continue and often increase during children's school years. Now, since Brown versus the Board of Education over 50 years ago, access to quality education has been the focus of the civil rights movement, and rightly so. I'm sure we can all agree that until we provide quality education to all children, regardless of their race or income, we have virtually no chance of achieving true and lasting racial and social justice. But once again, access to health care is essential for real educational opportunity. Studies conducted without regard to race have shown a direct link between prenatal health care and childhood health. Education research has demonstrated direct connections between children's health, children's school attendance, and long-term academic achievement. If we know that low-income and minority women do not have access to quality prenatal care, then we know that their children will be less healthy, attend fewer days of school, and achieve less academically. Now just think about two seemingly unrelated problems that are plaguing school-aged children in this country. In addition to visiting family physicians and dentists, children need to be examined by eye doctors. How is even the brightest child going to learn to read and write and do mathematics if she can't see properly? And how will she be able to see properly if she has undiagnosed and untreated nearsightedness or astigmatism? What if the difference between success and failure is simply a pair of eyeglasses? Now, perhaps the most dangerous long-term health crisis facing the nation is the obesity epidemic, with its profound array of economic and health consequences. While there is no official definition of obesity for children, the numbers of overweight children have skyrocketed over the last 3 decades. According to the National Center for Health Statistics, the percentage of overweight adolescents has increased 2.5-fold, from 6% in 1974 to 15% in 2002. Among elementary school children, the rate has nearly quadrupled, from 4% to 15%. Those numbers double to 30% if you include children who are deemed at risk of becoming overweight. The overall numbers are alarming for all Americans, but they are far worse for minority children, with African American and Latino youth approximately twice as likely to be overweight as their white counterparts. Now, being overweight has profound and immediate health consequences for children. There are increasing instances of chronic conditions like diabetes, asthma, high blood pressure, and cholesterol, sleep apnea, and a wide range of bone and joint problems. All of these health problems impose catastrophic costs on families and further detract from a child's ability to learn. Fast forward a few years, and all of these problems diminish the opportunities of mature workers, just as they shrink the futures of our children. When adult Americans can't see properly, have chronic medical conditions, and suffer from inadequate education,